Hello everyone, this is Dr. Kiran. Welcome back to Homeo Vision. So in the previous video, we have been dealt with AIPGT 2023 Repertory previous year question. In this video, I will be dealing with AIPGT 2022 Repertory previous year question. Before I jump on to the actual topic, as you all know, in the AIPGT 2024, Repertory has been allotted 16 questions. Okay, so that means 16 into 4. You nearly have 64 marks get allotted if you get the repertory questions correctly. Okay, so considering that in mind, what are the key areas of the focus for the examiner to ask the questions can also be judged based on the previous year question. Okay, so one common area is rubric hunting. Okay, rubric hunting is the most common expected question in the AIPGTs. Even it will be helpful for your clinical practice as well, because once the patient tells the symptom, you should be in a state to convert it into right rubric and the exact rubric. Okay, so considering AIPGT in mind, though we have many repertories, the usually trend of asking the questions is from the basic repertories, that is BBCR, BTPB, as well as the Kent repertory. Okay, so rubric hunting is one area of focus, whereas the second area is single drug rubric from various chapters of it can be mind, or it can be generalities, or it can be other parts of the body. Based on the examiner's interest, they may ask question to identify the single drug rubrics in all the three basic repertories like BTPB, BBCR and Kent repertory. Okay, so let's move on to the first question. So first question here is, arrange the following subchapters of urinary organs of Kent's repertory in order of their appearance from the first to last. So they have asked here the question is about the arrangement of the urinary organ chapter of Kent's repertory. Okay, so it's actually a very easy question if you would have gone through, if you would have glanced at the Kent repertory many times, this would be an easy question. Okay, so there are 5 options we should which again contains inside the urinary organ like urethra, urine, bladder, kidney and prostate. So this is a very easy question if you know the arrangement of the urinary organs of Kent chapter. Okay, so in Kent repertory, if you know that urinary bladder is actually alphabetically arranged. Okay, so that means in the alphabetical order the chapters are given. Okay, so even in your AIPGT, if the question is how many chapters are there in Kent repertory, if there is an option to write it as to mark it as option number like 33 chapters, you can go for it. If there is no 33 chapter, your answer should be 37. Okay, because urinary bladder has been split into 5 different subunits. Okay, so here the question was in what arrangement the bladder chapter, urinary organ chapter has been arranged. Okay, so here if you see the repertory, so the first chapter is bladder, then kidneys, then prostate gland, then urethra and then urine. So it is alphabetically arranged, so it's a quite easy question to score good marks here. Okay, so the right answer is option C. Okay, so moving on to next question. Orgasm of blood is mentioned in which chapter of Kent's repertory? So again, this is a question from Kent's repertory. So there are 4 chapters given or 4 options. We need to identify the right option. Okay, so and majority of the students who have attempted AIPGT 2022 have got this question wrong, because they think orgasm of blood is in female genitalia chapter. Okay, so which is a wrong notion. Here when you see the Kent repertory, under generalities you have orgasm of blood. Okay, so orgasm is also related to symptoms like congestion or increased blood flow as well. So that is why it is given in the generalities chapter, orgasm of blood. So the right answer is generalities chapter. Okay, so moving on to next question. Question number 3. Which of the following rubrics are present in BBCR repertory but absent in Kent repertory? Even in AIPGT 2023, there was a question very similar to that, where you need to find the rubric which is absent in Kent repertory but present in the BBCR repertory. Okay, so there are 4 options given. Okay, so let's see whether in which chapter the right rubric is actually given. Okay, so in the BBCR chapter, okay, under sensation and complaints, there is a rubric reflexes diminished. Okay, so that is ruled out actually, Okay, so reflexes diminished is present in BBCR chapter. Okay, so then you need to see the next rubric, that is satyriasis. So satyriasis is seen in BBCR chapter under sexual impulse. Satyriasis is nothing but the increased sexual desire in males. Okay, whereas in females it is called as nymphomania. Okay, so this rubric is not there in Kent repertory as well. So whereas the next rubric, sucking of the thumb, is directly given in the upper extremity. So this is a quite common rubric with dealing with the children. So we have children like calcarea first child, also silesia as a rubric. Okay, you have chamomilla, you have sulfur. So this rubric is given in BBCR repertory. Okay, whereas the other two rubrics in Kent repertory, okay, hysteria. Okay, so hysteria is the most common mind rubric we use in day in and day out of the practice. So hysteria is mentioned in Kent repertory, but it is not there in BBCR repertory. Okay, so here the next one is the imbecility. Okay, imbecility is nothing but stupid or an idiotic person. Okay, so imbecility is also given in, you can remember one remedy, Beretta curve here. Okay, so these are the two rubrics where you can see in Kent repertory, but it is not found in BBCR repertory. Okay, so the answer is option 4, A, B and D only. Okay, so moving on to fourth question, arrange the following chapters of Boningosson therapeutic pocketbook from the first to last. Okay, so that is why see here again they have asked the same area like urinary organs area, where the first question was from Kent repertory, this question is from the BTPB repertory. Okay, so as I already dealt in the Kent repertory, it is alphabetically arranged. Okay, whereas in Boningosson therapeutic pocketbook, these chapters actually are arranged divided according to the system. Okay, first you will be having the urinary system, and then you will be having the female genitalia or the menstruation and lucorial related symptoms. Okay, so when you get back to the question, now you can easily classify it into two different groups. Okay, so initially we will start with the urinary system, then arrangement is according to the female genitalia or leukorrhea and menstrual symptom. Okay, the answer is B, C, A, E, D. Okay, so first is the urine, then you have micturition, then you have sexual organs, then followed by that menstruation, then leukorrhea. Okay, so if you know the arrangement of the chapter, these type of questions are very easy to answer, and then again it will fetch you good number of marks when compared to your subordinates. Okay, moving on to next question, which of the following repertory is not published by the Guernsey? As I already multiple times I have already told you that no, always read the question twice. So here what the question they have mentioned is, which of the following repertories is not published by Guernsey? Okay, so before we know what repertories he has published, we should know about who is Guernsey as well. Okay, so there are four options. Okay, we should rule out one repertory which has not been published by Guernsey. Okay, so this is a legendary Guernsey. His full name is Henry Newer Guernsey. Okay, so he was the first person who coined the term keynote. Okay, whatever we call it as keynote prescriptions today, it was coined by the Guernsey. Okay, Guernsey was the first person to coin the term keynotes. Okay, so he has contributed in the repertory field by publishing three major books. Okay, first one is a repertory of desires and aversion. It was published by Guernsey. The next one is repertory of hemorrhoids. Again, it is published by Guernsey. And also, there is something called as repertory of mastitis. Again, it is published by Guernsey. Okay, so all the three repertories are called as regional repertory. Okay, where you have related to some part of the body or some part of the disease. This is what we call it as regional repertory. So Guernsey has contributed quite a bit in the field of regional repertories. Okay, whereas the other option, repertory of the sciatica. Okay, so this was written by Alfred Pulford. Okay, so the right option is repertory of sciatica. Okay, so whereas the other three books have been published by Guernsey. Moving on to next question, what would be the correct arrangement of the symptom muscles refuse to obey the will when attention is turned away in Kent repertory? Okay, you have four options. So this is the rubric hunting question again, as I already told. Okay, so you need to identify the right rubric for this particular question. Okay, so here see there are two involvement. One is muscle refuse to obey the will, so there is affinity of the will as well as the muscle. Okay, so whenever this kind of question is always asked, okay, you should always jump onto the mind chapter, because Kent's repertory is known for mind chapter. Okay, so here there is a direct rubric: mind, will, muscles refuse to obey the will when attention is turned away. So here the single remedy is Helleborus. Okay, so the right arrangement is option 3: mind, will, muscles refuses to obey the will when attention is turned away. Okay, moving on to next question. Question number 7. Okay, at the initial part of this video I have already told that the two area of interest of the examiners or the question framers is one is Kent's repertory rubric hunting, as well as the single drug rubrics. Okay, so here, though they have not asked from the mind chapter, they have asked from a chapter head. Okay, so where you have yellow dandruff. Okay, it's a very simple, no need to convert it into any sub rubrics as such. It's a direct rubric. Okay, so under head chapter you have a rubric yellow dandruff. They are asking what is the single remedy mentioned in the particular question. Okay, so you have calichlor, mesarium, calisulf and thuja. Okay, so here most of the time if you already know the remedy, it's well and good, because you have already gone through the repertory. You might have been coming across this rubric, because many of the time when some patients consult you with seborrheic dermatitis or there is a dandruff, you directly have a rubric to go and check with the what all remedies you have. So here see, thuja is also a common remedy for dandruff, mesarium is also a common remedy for dandruff. Okay, so how do you differentiate? So the remedy for this particular question is calisulf. Okay, so this is the yellow dandruff and it's a single drug rubric. Here you can see the sub rubrics as well. Under head you have dandruff, under head dandruff white, head dandruff yellow. Under head dandruff yellow, the only remedy is calisulf. Okay, so it's a quite easy question if you have been aware of the Kent's repertory's arrangement, as well as if you are frequently using Kent's repertory. So this question becomes quite easy. And then moving on to 8th question. So this is a statement based question. Okay, so if you are already thorough with whatever statement you already known, then you can attempt this question, or else this will be a recipe. If you answer the question, again it will be a recipe for huge disaster, because you will lose one negative mark without knowing. If you try to answer the question, definitely, because the probability of getting the answer right is very low in this kind of question, unless and until you understand the subject very thoroughly and try to attempt it. Okay, so statement 1: the all drugs mentioned in the Kent repertory under chapter extremities, rubric heaviness, lower limb, exertion after A, okay, are mentioned in the first grade only. Okay, so what they are asking is, under the extremities, heaviness, lower limb, exertion after, all the remedies are mentioned in first grade or 3 mark. Okay, so let's verify the first statement whether it is true or wrong. Okay, so under the rubric extremities, heaviness, lower limb, exertion after, you have 5 remedies: conium, gelsemium, lachesis, picric acid and rustox. So as you can see, all the 5 remedies has been mentioned in the highest mark itself. Okay, or what we call it as first grade. So the statement 1 is correct. Okay, moving on to next question, moving on to next statement: all the drugs mentioned in BTPB under the chapter lower extremities, rubric patella, are mentioned in the first grade only. So similarly in the BTPB, see, this is a combination of repertory. This question is a combination of repertory, where the first statement is of Kent's repertory and second statement is of BTPB repertory. Okay, so whereas in the lower extremities patella, not all remedies are mentioned in the first grade only. Only belladonna, camphora is mentioned in first grade, whereas other remedies are mentioned in different grades. So the statement 2 is incorrect. Okay, so here the right answer is statement 1 is correct and statement 2 is incorrect. Question number 9. So this is a match the following question. As I already told multiple times, always try to attempt match the following question, because if you are able to figure out one match exactly, so there are chances of getting the questions very right, and it's quite easy also majority of the time, because options will direct you to answer the right option as well. Okay, say for example here under list 1 you have rubrics, list 2 is the meaning of the rubric. So this is the question based on which the rubric is given. You need to identify the right meaning of the rubric. Okay, so here there are 4 options. Okay, so you have mania apoto, mentagra, impertinence and impetuous. Okay, if you have already opened the repertory and if you are already thorough with the repertory, so this question is taken from BBCR. Okay, so and you have many older terminologies. Say for example, mania apoto is there. So it is a Latin word for delirium tremens. So you can rule out directly. Option A is nothing but 3. Okay, so option A, if you are able to rule out one thing, like example mania apoto is delirium tremens, option A, and under list 1, for A option you have 3, and that is delirium tremens. So you are able to rule out the other two. Option 2 and option 4 is gone because you are very thorough with the mania apoto is delirium tremens. So you are only left with 1 and 3. Okay, even in this, if you are able to rule out B, C, D, it is well and good. If you are not able to rule out that, then probably you can take risk in this kind of questions, because the probability of getting the answer correct will be 50%. See, and one option 1 and option 3, again the D is 2. Okay, D2 in the sense impetuous is impulsive and hurried. So you're able to rule out two things, and if you're able to differentiate between B and C, then you might end up in answering the right question. Then, so mania apoto is the Latin word for delirium tremens. Okay, so then mentagra. Okay, mentagra is the rubric given in BBCR. So it is the older terminology for barber seeds. Okay, so if you're able to rule out two things, then you can directly answer this question, and the answer is A3, B4, C1 and D2. Okay, so moving on to 10th question. The only remedy mentioned in BTPB for aggravation from onion is. Okay, so as I already told, again this is a question based on single drug rubric from the BTPB, from the aggravation. Okay, so the only remedy for aggravation of onion is Thuja occidentalis. Okay, so Thuja is the one remedy where there is aggravation from onion, and in the BTPB repertory it is a single drug rubric. Moving on to next question. The only remedy mentioned in Boninghosen therapeutic, so this is the only remedy mentioned in Boninghosen therapeutic pocket book for onion aggravation. Okay, so Thuja occidentalis. Moving on to next question. Again, this is a match the following question based on the BBCR. Here, the list 1 they have mentioned the rubric in BBCR, and list 2 they have mentioned the meaning. Okay, let's see what it is exactly. Okay, so this is the rubrics mentioned from the mind chapters of BBCR, and all the 4 rubrics are single drug rubrics. Okay, so here if you are able to rule out one question, one rubric exactly the reference, then it would be very easy. Okay, so for at least I know, like for mind communicative, the remedy is lachesis. Okay, see the option is also quite easy. A matches with 3. So the single remedy under mind communicative is lachesis. So option A, 3 is there. Okay, so whereas the other 3 option it is ruled out. Okay, so these are the, see in match the following question, majority of the time we should use the ruling out technique than trying to answer the entire thing. Okay, so here the answer is, it's a single drug rubric from mind chapter, and the answer is, for mind communicative you have lachesis, clothes destroy his, you have veratrum album, ferocity you have opium, mischievousness you have arsenicum album. So the right answer is option 3. Moving on to 12th question. The total number of drugs mentioned in characteristics materia medica part of Boger-Boninghosen repertory are. Okay, so you need to mention the total number of drugs mentioned in the characteristic part of the materia medica. So read the question very thoroughly, because they have mentioned the characteristic materia medica part, how many number of remedies are there. Okay, as you know, this is the BBCR repertory. Okay, so they have mentioned in the highlighted yellow mark that there is characteristic as well as the repertory. So characteristics is nothing but the materia medica part, whereas the first part of the book is materia medica, and then you have the repertory part. The second part is repertory part. Okay, so here the question asked here was, what are the number of remedies mentioned in characteristic part of the materia medica? Okay, so the right answer is 140. Okay, whereas in repertory, that is why only the materia medica part question has been asked, how many number of remedies are there. So the answer is 140. Okay, moving on to next question. The only remedy mentioned in aggravation in moonlight in therapeutic pocketbook. Again, it's a single drug rubric from the chapter aggravation from BTPB. Okay, so there are many single drug rubrics asked in AIAPGET 2022, especially from BTPB. Okay, so your area of interest will also be single drug rubrics from different chapters of all the three basic repertories. Okay, so the only remedy mentioned is anti-crude. So there is a separate chapter aggravation in BTPB. Under that direct rubric moonlight is mentioned. Under that the remedy is anti-crude. Moving on to next and last question. The rubric aversion for dry food is found in which chapter of BBCR? So it's a question from BBCR. The symptom is given. We need to identify which chapter does the rubric belong to. So option 1 appetite, option 2 taste, option 3 stomach and epigastrium, option 4 conditions in general. Okay, so before we jump to the whenever you study a rubric or whenever you study the chapter, you always try to compare with other two subordinate repertories as well, like BTPB as well as Kent. Okay, so here, okay, so in the appetite chapter, aversion to dry food is given. The single remedy is Merck. Okay, so I'll also try to compare with other two repertories as well. Okay, so in the BTPB, desire and aversion are given in hunger and thirst chapter. Okay, so this is the error with the PPT. Okay, so in stomach, in Kent's repertory it is given in the stomach chapter, whereas in the BBCR repertory it is given in the appetite chapter. Okay, I repeat once again, hunger and thirst, desire and aversions are given in hunger and thirst chapter of BTPB repertory, appetite chapter of BBCR repertory, and stomach chapter of Kent's repertory. Okay, so this is the right answer is appetite. Okay, so always try to understand the basics of repertory before you answer the question, and also try to read the question multiple times and also see the options very thoroughly, because the exam is based on CBT, computer based test. Okay, so there are chances you may miss some certain words. Always try to read the question completely, options completely, and then try to answer. Okay, so this will be the end of this video. So you have come across 14 questions from the AIAPGET 2022 previous year questions. I hope this video was helpful, and thank you.